All right, so for the next of, we establish a link between septicemia and heart failure. All right, septicemia, I just want you guys to understand septicemia as, yes, there was an infection. The infection went into the bloodstream. Do you understand? Then there was kind of like a widespread of that infection in the body. Okay, so this septicemia, infection came into the bloodstream. It spread to a whole lot of organs. Do you understand? But especially, we're actually looking at the effect it will have on the heart. Okay, in terms of heart failure. So let's establish a link between septicemia. So we'll start with an introduction, which is said as septicemia is known as sepsis. It's a life-threatening condition. It's caused by severe infection. So the infection is spreading through the bloodstream for it to be able to get to other organs. Okay, so in children, especially those with immature immune system, so children are still coming up, their immune system is not that strong yet. You understand? So it can rapidly progress. It can lead to septic shock. It can lead to heart failure. So pathophysiology, that's how sepsis leads to heart failure. We're establishing the links. Okay, what is the link between this and this? What is the link between this and this? So sepsis triggers a massive inflammatory response because the body's immune system is trying to tackle the infection. You understand? So now the widespread inflammatory response affects every organ, okay, including the heart. There's an inflammation because it wants to set the pathogens on fire, literally. Do you understand? But it can also affect other organs too. So it affects the heart by myocardial depression. So inflammatory cytokines and nitric oxide directly impair heart muscle function. The heart becomes less able to contract effectively. It reduces cardiac output. Then microvascular dysfunction. Now sepsis damages small blood vessels. This leads to poor oxygen delivery to heart muscles. Okay, all right. This causes ischemia. So there's lack of oxygen. Further weakens the heart. Oxygen is the energy currency, right? Yes, ATP. Okay, oxygen burns the energy. Do you understand? So mitochondrial dysfunction. So sepsis disrupts energy production in heart cells by damaging the mitochondria. So if you don't have enough oxygen, of course you can't actually maintain normal function. The ventricular-atrial uncoupling. So coordination between the heart and blood vessels breaks down. So this leads to inefficient blood flow and increased strain on the heart. Okay, so clinical consequence in children. So children with septicemia may develop septic shock, multi-organ dysfunction syndrome, arrhythmias, dilated cardiomyopathies. So the whole complications could actually rapidly lead to acute heart failure, especially if not treated promptly. Do you understand? So that's just it. That's the linkage between sepsis, okay, widespread of infection, and how it can be able to cause heart failure, especially in children.